Thank you very much, Dr. Luhanga, for your very kind words. I will be speaking on the national perspective with regard to the issue of nutrition, agriculture, and health. And I just want to share something with you before I move on. I have several very wonderful brothers and sisters, and once in a while we meet, discuss issues and reflect on how we grew up. So when we meet, we remind each other of the little things that we did when we were young. And I believe you also have that kind of a history. One thing that my siblings always get me on is with regard to food. They remind me how one day my mom, coming from a well where she went to draw water, and she called on my name and I couldn't answer. And I did not answer for one reason, because while she was away drawing water, I was having food security in the form of stealing beans that had been cooked that day. So I had a mouthful of beans, and when she called on my name, I could not respond, because how do you respond with a mouthful of beans? When I was preparing what I'm going to speak on, I thought that was a sign of food insecurity in the home. I cannot imagine my son stealing beans today. I cannot imagine my daughter stealing chicken. It's there all the time. And we have a responsibility as Ministry of Agriculture and partners in agriculture to ensure that everybody in every household really has the food, so that kids don't grow up really stealing beans and failing to answer parents when they come back. This is a story that can be shared in many parts of Malawi, food insecurity, and we are partly responsible for that. The question of what works and what does not work in as far as nutrition, health, and agriculture still continues in many, many forums to be discussed. And I would like to indicate in the national perspective one program that I believe really, really worked. We have very good empirical evidence related to that. And this was the Micronutrient and Health Program, in short, MICA. This was the World Vision Program implemented between 1996 and 1995 and 2005. Let's go back to 1990. World leaders met in New York at the World Children's Summit. One of the commitments they made was to ensure that malnutrition is reduced, particularly in developing countries where the problem is very evident. 2 years later, the international community met in Rome at the International Congress on Nutrition, ICN, where further commitments to reduce malnutrition were made, with very clear strategies in agriculture, health, and nutrition. In 1994, the World Bank released a report of a study after looking at a lot of evidence, and came to conclude very, very clearly that if you reduce micronutrient malnutrition, it will result in a significant and expedited reduction in child mortality. Now, when the World Bank speaks, institutions listen. We were here on 28th July launching the national, the SUN, the Scaling Up Nutrition 1000 Special Days movement. After a lot of work in the Lancet and all that, it was a World Bank report of 2009, which really showed that, yeah, you can actually reduce malnutrition if you make investments in this area. When that report came out, one of the institutions that picked the recommendation from World Bank was CIDA, the Canadian International Development Agency, and World Vision International. These two institutions started deliberations. How do we translate that into actions in Africa? So they came to Africa and talked to 5 governments, including Malawi. And the Malawi government responded by allowing that partnership of World Vision and Malawi government through Ministry of Health and other partners to implement the micronutrient and health program. The program ran from 1996 through 2005, and I'd like to make 3 conclusions that I'd like you to keep at the back of your minds in terms of how I think agriculture has the potential to unleash, to unlock the potentials that are there to enhance better nutrition and health. Number 1, integration. Through the MICA program, the evidence that we have is that if we integrate a battery of interventions in agriculture, in nutrition and health, which have known efficacy and effectiveness, it enables us to deliver the most critical socio-economic needs of the majority population who need them most, who have multiple needs. Let us remember, people in Malawi do not have one need or just a few needs, they have multiple needs. Number 2, that community-based interventions are more likely to work than other approaches because of the nature of our population, where our people live and our culture and our society, how they are organized. Lastly, long-term, other than short-term programs and projects are more likely to show us better impact than 2-year projects, than 2-year programs. They have to be relatively long-term. So, what makes me say that? The MICA program was implemented with the following objective, and that was to improve the nutrition and health status of women and children through the most cost-effective and sustainable interventions. The specific objectives of the program were to increase intake and bioavailability of vitamin A, iron, and iodine. Number 2, to decrease diseases that affect micronutrient malnutrition. And lastly, to build capacity for delivery systems. What the MICA program did was to work with some of the most poor people in Malawi. Somebody told me that the poor, don't waste time with the poorest of the people because they don't give you have to work too hard for you to change them. MICA program says no. Even those very poor people can actually change. What happened after implementing this program? I'll tell you that at the beginning of the program, the baseline showed 60% prevalence of stunting. 6 out of 10 children were stunted in Malawi. In the areas where the program was implemented, using so many interventions, one where there were micronutrient supplementation, food fortification, exclusive breastfeeding, dietary diversification, modification with emphasis on animal source foods, the home gardens, and other interventions. Stunting reduced from 60% to 43% in the MICA areas and 45% in the neighboring villages. When we go to anemia, it was very overwhelming at the baseline in 1996. Children with low hemoglobin were 87.6%. Almost 9 out of 10 children had low hemoglobin. By the end of an 8-year period of implementing the MICA program, integrated in nature as I have described it, children in the MICA areas, only 58% of children in the MICA areas remained anemic. While in the non-MICA areas, in the comparison areas, 70.6% of children are still anemic. What are we saying here? You're reducing from about 90% down to 50%. And in the areas where you're not doing these interventions, you're reducing from 90 to 70%. Within that time period of integrating agriculture, nutrition, and health, we were able to show results that you can reduce among the very poor people in Malawi prevalence of anemia and stuntedness. What is the take-home message? Agriculture on its own will not work. Nutrition in its own won't work. Health in its own will not work. Environment will not work. Nothing, nobody on our own is going to work. What is going to work is integrating everything together. In Malawi, the evidence